And welcome, Rose.
Good to be here.
Hi.
Hi.
So, Rose Jackson Beavers is the senior program manager of the Bridges to Care and Recovery Program. And I was honored to serve as the chair of the steering committee for the Bridges to Care and Recovery Program. And we're just so happy to be here to share with you all this model that has made a major impact in congregations in the St. Louis community. So we have a PowerPoint that we will use to share with you some content. But Rose and I just love having conversations to share information. So we'll get this PowerPoint launched here, and we're going to share with you what the mission of Bridges to Care and Recovery is. So we are just gracious to be here. Uh, and so let's get this started.
Okay. Bridges to Care and Recovery is an initiative of the Behavior Health Network. Our mission is to mobilize clusters of churches in North St. Louis City and North St. Louis County and to support the behavior health treatment and recovery of the church and communities in their members with behavior health disorders. In addition, is to extend the system of care for people who are challenged with behavior health disorder. So what we do is basically we work with pastors and their congregants in the St. Louis City and North County area to make people aware about the stigma that's associated with mental health, and we do it through our mission.
So we have some key goals here, and one of those goals is to reduce the stigma of mental illness in faith-based communities. And we do this by equipping congregations to talk about those behavioral health issues and then increasing congregation participants' understanding and the acceptance of behavioral health through training and education. Now, we'll discuss what that training and education looks like in a moment, but the key goal here is to reduce that stigma. And by doing that, we open the doors for congregations to be able to support not only those individuals with mental illness, but their families, their friends, their loved ones, and the community at large. I'm going to ask Rose to talk about the idea of the partnerships that happen with BHN and congregations.
Yes, the Behavior Health Network has a huge number of providers and partners that we work with. These individuals are invited to participate on numerous of boards that we serve. One of them is the steering committee for the Bridges to Care and Recovery Program. These partners open doors for better access to treatment for those individuals who are seeking help. They also assure that we have other programs and other resources to help those who are in need. Some of those partners are community health centers. We work with a crisis counseling program called Show Me Hope. We work with hospitals and other associations, universities, and all these individuals sit on boards with us. They help us to problem solve, to plan. They help us with access, awareness, and education. They provide training to our congregants who are interested in our program. So we use them in all kind of roles to address the behavior health crises that we're having in our communities.
So truly what we have done is
Jermaine, Jermaine, push the microphone a little bit away from your mouth. You're a little too hot.
So truly what we've done is we have built a bridge of connections between the faith communities as well as all these different stakeholders. And that's what makes Bridges to Care and Recovery work. Because not only is it faith communities alone in this journey, but now they have connected with providers and other stakeholders that can help bring those resources to the table. So this is one of the most important elements of the Bridges to Care Recovery Program is the partnerships. So the other goal is to equip. And we want to equip those congregations with the tools they need to develop wellness ministries. And I think that idea of wellness ministries is very important because we're talking about the wholeness of the individual, both spiritual, physical, and emotional. And so we're developing those wellness ministries and then creating opportunities for people to volunteer to create long-term sustainability. The other goal is as we partner with law enforcement and the emergency rooms, uh, the goal is to divert the resources that are often used by persons going to emergency rooms to get help or law enforcement being called to assist persons in crisis, getting them involved as an early intervention approach versus when it's a crisis is another important element of the Bridges to Care and Recovery model. So
Another
let's
thing,
move. Yeah,
I
yes.
was going to say, and another thing with trying to equip congregations, one of the things that we found is that many of our churches have physical ministries where they deal with various issues like cancer, just diabetes, and those kind of things. But oftentimes we find that nothing is happening for the brain, which is the most important part of our body. And we try to really encourage people to deal with those issues that deal with the behavior health problems that people are handling so that they won't be afraid to talk about those issues. So that's where we're coming in with developing those wellness ministries by adding in the mental health component.
You know, we do have those heart awareness Sundays, diabetes awareness Sundays. But what Bridges to Care and Recovery has done, as you mentioned, is highlighted that the brain is a very important organ that when it is not healthy, needs the same care, attention, love, and respect as the heart, the liver, or the kidneys. So this work is so important in heightening that awareness. So Rose, I want you to share with the audience the great work that has happened so far with a number of churches that have been designated, the wellness champions, the outreach that has happened. So share those numbers with us.
Okay. Okay, so Bridges to Care and Recovery work with churches in these two areas to train them in a variety of topics. And once these churches are trained, they become what we call behavior health friendly congregations. The churches that we've trained so far is about 78. And so once they go through this 20 hours of training, which includes classes like companionship training, mental health first aid, they go through becoming a trauma informed congregation, and they go through this training program, which goes over about 6 months. And they only go once a month because we know that with churches, they're dealing with a lot of different other programming. So we tried to make it convenient for them. But once they complete the training program, they go through other advanced training. So far in our communities, we have trained 78 churches. Out of that number, there's 221 plus wellness champions. And wellness champions are people who are designated by the pastors to attend our training program. Oftentimes, it could be the pastor or someone in the church who might be a social worker or working in the health component, or just a volunteer who want to participate. These individuals, what they do is once they're trained, they refer church members to mental health who may have mental health challenges or know someone who have mental health challenges to behavioral health services. They also provide resources and information. And as Jermaine and I were saying earlier, with the activities that they have in the church with the programming, they're the ones who set up programming, set up awareness campaigns, work with the pastor to make sure that the pastor knows what's going on. And so they are the ones who serve as resources for those in need. And they have completed the 20 hours of training and have made a commitment to contribute to reducing the stigma that's associated by people in the communities of faith. Wellness Champions have reached over 9,000 people through virtual presentations. So with the COVID situation that's going on in our communities now, we equipped 10 of these wellness champions with laptops and Zoom subscriptions so that they can help us work with the 78 churches to provide information through virtual presentations on Facebook, through Zoom, across their social media platforms. And they're talking about not only COVID information, but grief, fear, mental health issues, and making sure that they can spread that information. This helps us with stability and give them confidence in being able to present information to a large group of people. These wellness champions have educated more than 2,000 individuals about the importance of completing their 2020 census. So they get an opportunity to not only just deal with behavioral health issues, but they're doing census, they're working with trying to get Medicaid confirmed so that individuals will be able to get help when they need behavioral health assistance.
Rose, thank you so much for sharing that. And I want to apologize for the technical difficulties that was happening earlier with the echoing. That's been fixed now. So I hope you are having a better listening experience now. So we most definitely want to apologize for that echoing that was happening and the first portion of our time together. Rose has shared a lot of great information about the impact of Bridges to Care and Recovery. To me, I'm amazed the fact that we have served over 78 congregations, churches since 2015. And I want folks to know that there's a waiting list oftentimes to actually get into this program. And so what's happened is that we have had pastors who have actually championed this model. And it starts from the pulpit. It starts from that sacred place. And that's when, if you as a faith leader are endorsing, listen, how we treat people matter. How we treat people matter. So that's why this program, I believe, has been so successful, because we have the buy-in from those faith leaders from the very beginning. And we're going to talk about how Bridges Care Recovery from beginning to graduation, how that works in a moment. In front of you is a slide of a hotline. And Rose, share with the listening audience the importance of how this hotline got set up, because now there's a warm pass-off for that mental health champion. There's a warm wellness champion, should I say, a warm handoff here, even through a hotline. You want to talk about this hotline?
Yes. So we have individuals that we hire. They are called community connectors. These connectors help us not only to recruit churches and wellness champions, they also help in training and referring individuals to our hotline. Now, with our hotline, we were initially funded through the Department of Mental Health and some universities and churches who gave us the seed money to start the program. So one of our partners, which is the Behavior Health Response organization in our community, is a national hotline where you can call in for suicide issues or depression or whatever that's happening. We are connected to them. They answer our hotline, and individuals who do not have health insurance are referred through the churches, through our community, to our hotline, and those individuals can get up to 5 sessions of free counseling. And if they need more, we would extend it by an additional 3. So not only are we training the churches, but we're making sure, because the stigma exists around those issues, to provide a service to make sure that they feel comfortable. Now that we're making them aware about the stigma, we're making them aware about mental health issues and not to be afraid to deal with what's happening to them. Now they have the resource to call our hotline to get 5 sessions of free counseling if they do not have insurance to do so.
So think about that. What we know is those first 5 initial sessions gives that individual a good opportunity to be able to be assessed by a clinician to be able to discover what may be happening in that person's life. And I know when we first did this, that we had folks that blew through the 5 and needed more. And we had to extend, which now you're saying there's additional 3 more offering. When we first started this, people were getting not only 5, but 10 sometimes because they just needed the help so bad. So once again, what makes Bridges of Care and Recovery so successful is the partnership. So what we have, as you can see, the hotline where folks can call and get free counseling, but also connected to the behavioral health response, which is, as Rose said, our local suicide prevention lifeline where folks can get the help they need if they're in crisis. So once again, I cannot stress this does not work without partnership with those community stakeholders. This is what makes this work. So I want to make sure that you get Rose information early in this talk because we're going to stop sharing the PowerPoint for the next 10, 15 minutes. We're going to just chat about the Bridges of Care and Recovery program. So take a screenshot of this information here. If you're in the St. Louis area, North City, North County, and you're interested in saying, how do I get my church involved? Call Rose Jackson Beavers. Listen, I'm promising you that 20 hours of training will equip your congregation to be able to help not only your congregants, but those in your community at large. So, Rose, you want to share your information with folks?
Yes.
It's on the screen, but yes, you can share it. Just share it with them.
And if you see that I have on the screen that we are recruiting for cluster 7, we have already trained 6 clusters. And in those clusters, we graduated 78 churches. Our goal is to train as many churches as we possibly can. I noticed in the comment sections that someone is asking what the 20 hours of training look like. Individuals are recruited. We go through a pastoral orientation where we give them more information about the training program, what that's going to consist of. Then we have a kickoff where we're inviting the whole community, St. Louis if possible, to come in to hear why this information is so important to our community. Our community has been dealing with the stigma for so long. Jermaine and I will talk a little bit about why it's so important to speak from the pulpit about mental health so that people will feel comfortable, know that it's okay, know that they can live a normal life with support, with help, and that there's nothing wrong with it. We want people to know that recovery is possible. How those classes look, they go through 20 hours. They begin off with what we call trauma-informed, becoming a trauma-informed congregation. This is really important to congregations to understand what trauma looks like, how it could activate itself, even through just a presentation that a pastor is preaching in a pulpit. They go through understanding suicide because we're finding that people are really stressed. They're going through so much in the church. Oftentimes, they don't understand how to deal with a temporary situation, making permanent decisions. And then they go through what we call companionship training. This is through Jermaine's organization. They are one of our partners who come in and they train the congregants how to become companions with those who are in their church, with those who are seeking support from others. We also go to motivational interviewing. How do you confront or talk to somebody who is dealing with issues and are afraid to talk? We teach them how to build behavioral health ministries, how to set up rooms in their churches where people can go and become stress-free, read pamphlets, find other resources that are located in the rooms. We teach those wellness champions how to look for resources. The problem that we have in our community is access and information. So many times people don't know who to call for help. They don't feel comfortable picking up the phone. And this is where all those partners come into play. They're the ones who come into the classroom and train on many of the topics that we have. So they're having face to face with organizations that they now feel comfortable with calling and talking to about issues. Those organizations also go to the churches and they do presentations inside of the church. So we do role plays to let them know how to pick up the phone, what kind of questions to ask, how to talk to the individuals on the phone, how to locate resources for various situations that people are experiencing. Not only just sharing information with their church members, but the people who come through their food pantry, the people in their community. So after they go through this training program, they graduate. We have a huge graduation where they get an opportunity to listen to people who may have suffered from mental illness, but are now in working with other people, speaking. We have speakers come in, such as Jermaine Aberty and others who talk to individuals who are getting ready to graduate. Their family members are there. It's a big celebration, a banquet. And then they receive a plaque. And on the plaque, it says that this church is a behavior health friendly congregation, and the wellness champions get certificates. And what this means is they can put this plaque in their church vestibule, their hallway, so that when people walk into the church, if I'm suffering from any kind of illness, I feel depressed, and I see this plaque on the wall, it makes me feel like I'm in a safe place. In addition to that, with all the churches that we're training, we have individuals who contact our organization and say things like, I suffer from bipolar. Do you know a church that will accept me? Do you know? And we just ask them, what is your zip code? And we will give them the numbers to those churches just to contact. No, we're not recruiting people for churches or anything like that. But we make sure that if people feel good and comfortable and know that churches are helping them and will accept them, they're most likely able to stay on their medication, to continue their health regimens, and also feel that they're a part of a group who understands what they're going through.
Rose, thank you so much for sharing. I want to address a few things I'm saying in the chat there so you can know we are most definitely looking and reading the chat. I just put out that if you're interested in setting up the Bridges to Care and Recovery model, reach out to myself. My email address is there in the chat, jalberty@pathways-to-promise.org. We're working with Doug Beach and NAMI San Antonio and the City of San Antonio Faith-Based National Office to bring this to San Antonio. And so we're going to have that discussion at 12:40, I believe it is. Plenary discussion about that in San Antonio. If you're interested, join that plenary about that discussion. But if you're interested in bringing it somewhere other than San Antonio, and you say, hey, I want this in my community, reach out to us so we can share this with you. This is a movement because we know that once we increase literacy, we reduce stigma. Now let's talk about this idea of behavior health friendly church, because I wrestled in steering committee meetings with the term behavior health friendly. I wrestled with it. So I know somebody said maybe that's part of the problem. The thing about it is when you say the term mental health, there is stigma attached to just those two words, mental health, in some African American communities. It's going to shut the door automatically. So it's been culturally sensitive and also having some humility that when pastors say, if I say those two words, it's going to shut down the whole thing. So we talked about what can we talk about that would at least encourage folks to come to the table. And we know that many states have gone from mental health to behavior health. So we know that. Now, I understand that we do not want to equate person's illnesses just to their behaviors. I get that. I understand that 100%. But by working with those pastors and meeting them where they are, then through education, we can reduce the stigma. And by reducing that stigma, then we can let them know that your mental health, your physical health, your spiritual health, it's about wholeness, complete wholeness. in all areas of your life. And so I see somebody saying this is not just an African American issue either. It's stigmas across the board. So we want to make sure that we say, what can we do to get into the door and then meet you there and then help increase your literacy? So most definitely, I saw that for sure there in the chat and wanted to make sure that we did address that came up also. Just know that this can be applied to any faith group, okay? So this doesn't have to be only Christian oriented organizations. This could be Muslim, Hindu, Buddhist, because the goal is to increase literacy and say, listen, we know when people are ill, they often turn to their faith and spiritual communities for support. If those faith and spiritual communities are not equipped to help those persons, then they often lose hope because the only place that I thought I could go to get help doesn't even understand what I am experiencing. So this is not just a Christian initiative. Pathways to Promise is an interfaith organization, and we want to ensure that we are increasing literacy and reducing stigma across this nation and the world. So what's really important is that what we do, post COVID, we would have like soul food dinners, like soul food lunches, and invite these pastors to come, because see, when you feed people, they show up. So we would have these soul food lunches and all the pastors would come in. So we would talk to their bellies, right? Talk to their bellies first. And then we would introduce the program and tell them what it's all about. But what really makes this happen is that we had a pastor, Pastor B.T. Rice, who served as our faith-based consultant. So he was the one going out there and calling his friends, said, hey, you want to hear about this Bridges to Care recovery program? Every program needs a champion. So if you can find that one pastor that will be a champion and bring along their colleagues. And so if she knows other pastors, then she'll call her pastor's friends up and say, hey, come on, this is a great program. And then if he knows other friends, then he'll call and imams and rabbis. Get those faith leaders who have a passion for this. And then the way this works is that they then designate a champion in their congregation, typically 2 folks, but Rose has had groups that have had like 10 people be champions, right?
Yes, we've had churches. It depends on the size of the church. Some churches send 1 wellness champion through. Some churches we've had churches send up to 12 wellness champions through our training. In addition to that, many pastors go through it because they want to know as much as they possibly can as well. And one of the things that happen after they graduate from the program, I mentioned a little bit earlier, we have an advanced track. And that advanced track includes things like grief, those kind of classes, dealing with holiday blues. We have things around holidays so that they will continuously be able to get more information, learning more. So the learning never stops for them. It's up to them to come to the classes, to volunteer. We host the classes once a month. And this is what the great thing about it is, say, for instance, I don't want to do it anymore. This has been, a wonderful opportunity for me, but I have a lot of outstanding things that happen with my family member. But we have 2 other people in our church who wants to do this. The church can always send people to our training program. So it doesn't matter. You may have 4 people who are already active, and the pastor wants to get somebody else active in the church, and they call and say, when is your next class? We want to send 3 more people through the training. You can always do that. And the other thing that Jermaine and I haven't said yet is our program is free to the community, free to those churches who participate. All they have to do is to come and use those resources to help individuals. And one of the things that happen is, as a result of being involved with our hotline, we're able to do a lot of data to research where individuals are coming from. And we have 49% of our hotline calls are now coming from those churches that we've been training. So people are feeling more confident. They're feeling more able, because they have the knowledge to refer people and to make them feel comfortable to talk about it through those trainings in their church. So that 49% is awesome, coming from a community where the stigma is so strong because of what we've been taught in our earlier, in our homes, in our earlier life about mental health.
I see Doug jumped on, and there was a question about the difference between pathways to hope and bridges to care and recovery. Are you coming to yank us off the screen yet?
Well, we have a couple
Yeah.
more minutes, and I
Yeah.
wanted to highlight a couple things. Can you speak real quickly about what is the importance of churches joining together? I mean, how many churches did
Yeah.
you start out with in St. Louis, North St. Louis?
The
Our
first
first-
cluster, yeah.
Yes, the first cluster had 15 churches in it. The second, we can go up to 15. The second one had, excuse me, about 19. The advantage of all of the churches working together, we just had this conversation yesterday with a group of wellness champions, is they share information with each church. They
Mhm.
work together, they pool their resources, they have activities together. Even in the face of COVID, they're sharing face masks, they're sharing information. They're really, if I have a neighbor, I can do a drive-by just to see that wellness champion from another church may live closer in the community, and they're assisting each other in every kind of way. They have developed relationships across communities, and that's what's been a really strong advantage.
Let me just point out as we're winding up here, this is a program any community can begin. And you mentioned earlier reaching out to Rose, reaching out to you, Jermaine, to find out, to learn more about it. But I want to emphasize that this is really grassroots. This is really organizing at the community level. And over we find, that's where the relationships you build, that's where healing and recovery begin. There's also, I think as we've seen in the chat box, there's going to be a session at 12:40 on next steps, which is going to be, people from San Antonio talking about, well, how do we do this in San Antonio? But I think it will be instructive for anybody to listen to, because the same questions we're asking are questions that any other community is going to ask. And I really encourage everybody on this call, on the conference today, to really think about how this could work in your community.
And Doug, let me point out also, when Rose says that it's free, that language it's at no cost to the congregation. So there is a cost to do this, but that cost has been underwritten by the Department of Mental Health in Missouri, been underwritten by our system of care, which involve hospitals and other entities. So a pool of money has come in to support the overall effort to increase this work in faith communities. So what's free in the sense many times is those volunteers that commit themselves to this effort, that mental health champion. And even that comes at a cost, right? So it's going to involve a grassroots effort. It's going to involve resources coming together, and together this can happen in your community. And that's what I'm so excited about.
Yeah. And I want to thank Rose. Thank you. Hearing about it from somebody who's doing it is always great. And Jermaine, thank you for doing this topic here at the Pathways to Hope Conference. We're going to take another short break before we come to our last speaker this morning, who will be Dan Gillison Jr. from NAMI. Thank you all for joining us today.
Thank you so much, Doug. Thank you.
Bet.